Okay friends, let's begin one of a small topic in pathology, blood components and transfusions. Some points in blood components and transfusions. So blood component, we have RBC and whole blood. It has to be storage. It has to be stored at 2 to 6 degrees Celsius. Fresh frozen plasma minus 30 degrees Celsius or lower temperature it has to be stored. Next one, cryoprecipitate. It is below minus 30 degrees Celsius. Albumin and factor 8. It is 2 to 8 degrees Celsius. Platelet, it has to be stored at 20 to 24 degrees Celsius. So this temperature, there is increased chance of bacterial contamination of this component. Okay. Next one is the blood storage if it is done with CDPA1. What is CDPA1? Citrate dextrose phosphate adenine 1. With this component, blood can be stored up to 35 days. Next, blood transfusion should be completed within 4 hours of releasing from blood bank. Otherwise, again, there will be increased risk of contamination. Next one, maximum chance of contamination is of which component? Again, this is the same, platelet transfusions, because its temperature, storage temperature is 20 to 24 degrees Celsius. Okay, so we have seen here 20 to 24 degree Celsius. Or patient receiving TTP, it is platelet transfusions. Okay. Next one, if we are receiving a patient of unknown blood group, okay, so blood group status is not known of a particular patient, and if we have only fresh frozen plasma, then which donor has to be from FFP? This is the AB blood group. So fresh frozen plasma from AB blood group can be given to this unknown blood group patient. Okay. Next one is most common reaction post blood transfusions. So this is the febrile non-hemolytic reaction. This is the most common post blood transfusion reaction. Next one, trolley. So we are going to see trolley, that is transfusion related acute lung injury, AHTR, acute hemolytic transfusions reaction, delayed hemolytic transfusion reaction, allergic reaction, and febrile and allergic reaction. Okay, let's see one by one. So what is trolley? Trolley is the transfusion related acute lung injury. It is neutrophil mediated. Neutrophil is present in the lung vasculature of the patient, and it occurs between 1 to 6 hours of blood transfusion. Next is the acute hemolytic transfusion reaction. This is a type 2 hypersensitivity reaction, and it occurs within 24 hours of blood transfusions. So patient feels a sense of impending doom. Okay, and hemoglobinuria, renal failure, and Coombs test is positive in AHTR. It occurs within 24 hours of blood transfusion. Next one is the delayed hemolytic transfusion reaction. So how much delay? It is the 24. It occurs only after 24 hours of blood transfusions, and there is history of exposure of RBC antigen. Okay, so there is prior history of RBC or blood transfusions from the same donor. So what is the presentation? Mild fever and hemolytic anemia. It is IgG antibodies mediated, and Coombs test is here also positive. Next one, what is allergic reaction? Okay, this is the fatal allergic reaction. This is Iga deficiency in the recipient. Iga deficiency in the recipient. So what happens? So there will be immediate reaction. Patient will complain of pruritus, tongue swelling, and stridor. So this is the life-threatening condition. Okay, and this is triggered by IgG of the recipient, and that recognize donor IgA. Recipient itself don't have IgA, okay, but donor blood has IgA. So recipient IgG will attack on IgA antibody. Okay, next and the last point is the febrile non-hemolytic transfusion related febrile non-hemolytic transfusion reaction. How we can prevent this? We can give leuko-reduced RBC. Then this episode incidents can be decreased in the patients. Okay, so thank you very much.